Hello everyone, this is Dr. Jonathan Gluck from Gluck Orthodontics in Nashville, Tennessee. And the purpose of this webinar is to present a basic overview of orthodontics and jaw surgery as a combination treatment. This is correction of a skeletal malocclusion in a non-growing patient. And what that means is the issue is related to the size, shape, or position of the upper and lower jaw bone, and this occurs in a non-growing patient such that we are not able to use the patient's growth as a way to help with treatment. It is a combination of orthodontics and a jaw surgery procedure, and the basic case types or types of malocclusion that we use jaw surgery to correct are what is known as a class 2, which is a large overbite, a class 3, which is an underbite, posterior crossbite, which involves constriction or narrowness of the upper jaw, and an anterior open bite. And we'll show several examples of these types of cases. In our practice in 2023, about 90% of our orthodontic and jaw surgery cases are done with clear aligners as opposed to traditional brackets and wires. Patients do not have their jaws wired shut, and there is a heavy component of the process that is digital with the digital diagnostic records as well as digital treatment planning, and we will show some examples of that in a few minutes. An overview of the sequence of events. The process begins with an orthodontic and surgical consultation. Usually those are done separately, a visit to the orthodontist or a visit to the surgeon. Doesn't really matter which one happens first. And that is a way to begin developing a treatment plan. The doctors will communicate back and forth, whether that's through emails or letters or phone calls or even visiting each other in their office to develop the treatment plan. Once the treatment plan is finalized, it's time to get started with the pre-surgical orthodontics. Once that part is complete, we will proceed to the actual surgical procedure as well as a period of healing after surgery, usually 6 to 8 weeks. After that is a period of post-surgical orthodontics. And overall, the treatment time from beginning to end, from the beginning of pre-surgical ortho to the end of post-surgical ortho, is on average 18 to 24 months, depending on the length of the orthodontic phase. So let's go back to the beginning and talk about the orthodontic consultation and what happens. Usually begins with a meet and greet with what's known as a treatment coordinator or a member of the office to talk through concerns or questions and reasons for seeking out treatment. Following that will be what are known as orthodontic records, which are diagnostic photographs, x-rays in either 2 dimensions or 3 dimensions, and a digital impression. Once that's complete, the doctor will come in, continue the meet and greet and an interview. They will do a clinical exam, take measurements, and then provide an overview of the diagnosis using the orthodontic records for demonstration. They will then go over a treatment plan, and often this will incorporate information if there was a prior surgical consultation, or if not, then the doctor may decide to wait on presenting a final treatment plan until after speaking with the surgeon. There will then be a financial presentation, including information about whether or not there is orthodontic coverage or orthodontic insurance to cover the treatment. And finally, they will schedule the next steps to getting started with treatment. Again, some of this depends on whether the initial consultation is with the orthodontist or the oral surgeon, but most of the time, the patient will see both doctors before getting started as a way to make sure everyone is on the same page. Here are some examples of diagnostic records. These are photographs, and you can see we have what are known as extraoral or the face pictures showing straight on with smiling and then a profile view. as well as the intraoral or teeth photos. The quality of the photos is incredibly important because they provide quite a bit of information for diagnostic purposes. These are the two most common two-dimensional x-rays. On the left, you will see what's called a Panorex or a panoramic x-ray, which shows all of the teeth, top and bottom, as well as the shape of the lower jaw, and you can see the shape of the jaw joints here and here, which are very important for making a thorough diagnosis. On the left side of the screen, right side of the screen, you will see what is called the lateral cephalometric x-ray, sometimes called a lateral head film. And this shows us the position of the upper jaw represented here, the lower jaw represented here, the upper teeth here, the lower teeth here. And we use this to do a very comprehensive jaw position and size analysis as a way to determine which of the jaws, whether it's the top or the bottom, needs to be included in the surgical plan. These days, a significant portion of diagnoses are done using three-dimensional x-rays, which is what's called a cone beam CT. And what you see from this screen are the top boxes and the bottom left boxes, which show actual slices through the 3D x-ray, and this can provide very accurate skeletal measurements or jaw position measurements. And then on the bottom right, you can see the actual skull representation, which shows us not only the teeth positions, but the jaw position as well. And this can be incredibly helpful when doing a skeletal diagnosis. This shows what's called a digital impression, and this is used to give us an accurate representation of the teeth. We're viewing this on the screen. We have the ability to look at the top and bottom, to rotate this in all planes of space. The other nice thing about a digital impression is we are actually able to use a 3D printing process to create a plastic model of these teeth, and I'll show you a picture of that in a bit. As a way to actually hold a model of the teeth in our hands, which can help with further diagnosis. So that concludes the diagnostic records. We talked about the first step of treatment being the pre-surgical orthodontic phase. And the goals of this phase are to straighten the teeth. Often patients come in with crowding or spacing or crooked teeth that we need to take care of. Another important component is to do what's called decompensation of the initial tooth positions. And what this means is when a patient has a malocclusion or a bite issue that is due to a skeletal or jaw problem, the teeth will move themselves into a place that is not balanced relative to where they should be. And so the orthodontist will perform tooth movements that address that imbalance such that after the surgical procedure, the teeth are in the proper position. They will also do what's called coordinating the arches, which addresses the position of the top teeth independently of the bottom, such that at the actual surgical procedure, the top and bottom teeth, the upper and lower jaw, will fit together properly. This orthodontic phase can be accomplished with either braces or Invisalign. There are some variations in terms of the overall timing of treatment, but for the most part, as we mentioned before, the treatment time for the pre-surgical phase is approximately 6 to 12 months, and that usually depends on the amount of decompensation that needs to be done and the amount of crowding or tooth alignment that needs to be done. Again, 6 to 12 months, and it ultimately depends on the complexity of the case. This is an example. What you see on the top are pictures of the case at the very beginning. You can see that we have some tooth alignment issues on the bottom. We also have some width where the bottom teeth have collapsed in due to some narrowness of the upper jaw. And on the bottom, you can see what the teeth look like once the pre-surgical orthodontic phase has been completed. And this patient is actually being prepped for surgery, and you can see that we have placed buttons on the teeth, which the surgeon will use to place the splint and rubber bands during surgery. So this is an example of an initial and then the conclusion of the pre-surgical orthodontic phase. I want to pause and comment quickly about the types of jaw surgery. Basically, there are two types. There is a one jaw surgery where the procedure is done on either the top jaw only or the bottom jaw only, or there is a two jaw surgery where the top and bottom are done together. Obviously, the two jaw is more complicated, involves more detailed planning, and often involves a longer hospital stay following the procedure. There are also several types of surgery for the top. There is what is known as a one piece, where the upper jaw is moved as a single unit. And there is called what's known as a segmental surgery, where the upper jaw is either split into two pieces, right and left, or what's called a three piece, where the upper jaw is split again into three pieces. And I will show you an example of that. Another very cool component of jaw surgery in 2023 is the use of digital surgical treatment planning. And so the oral surgeon can take the three-dimensional x-ray along with tooth models and use a service that will do surgical treatment planning on the computer, which allows for a more accurate final result. And what you can see from this case is this is a two-jaw procedure. And it's very interesting because the lower jaw actually involves a different type of surgery on the left side than it does on the right. This is also a segmental or three-piece upper jaw surgery, and the purple, yellow, and green depict the three segments of the upper jaw that will be created during the surgical procedure. As part of the pre-surgical orthodontic phase, the oral surgeon, when they're prepping for surgery, will do what's called a model surgery, where they will take digital models, these are the plastic 3D printed models, and they will cut them into pieces similar to how the actual surgical procedure will be done. And then they will use wax to reconnect them in the simulated final position. And on the right side of the screen, you can see the oral surgeon has connected the top and bottom jaws together to see how the teeth would fit together. And the pictures that you are looking at, if you recall the digital impression video that I showed a few minutes ago, this is the model surgery for that patient. And this is what our simulated outcome will be when the patient goes in for surgery. So, right before surgery, usually 3 to 5 days before, we will place surgical buttons or hooks. What you can see on the left is an example of an Invisalign or aligner patient who, instead of having braces on their teeth, we will place buttons along the gum line. And on the right side, this is a patient with braces, and we place hooks in between the braces on the top and bottom. And that will be used for the surgeon to connect the top and bottom with the surgical splint in place during the procedure. We will also take pre-surgical records, which usually involves an additional set of photos and x-rays. The day of surgery, surgery is done in the operating room under general anesthesia. And depending on the type of procedure, whether it's one or two jaw, the patient will usually stay 1 or 2 days in the hospital following the surgery. This is what the patient will look like when they are finished and come out of the operating room, where they will have a splint, which is that plastic wafer you can see on top of the top teeth, and they will have rubber bands, which are helping to keep the top and bottom fitting together properly. After surgery, we'll begin the post-surgical orthodontic phase. This usually starts around 6 to 8 weeks following the surgical procedure. During that 6 to 8 weeks, the patient will be under the care of the surgeon, going in every couple weeks for healing, potentially changing out rubber bands, things like that. The post-surgical orthodontic phase often takes about 4 to 6 months to complete. And during that time, we are finalizing any tooth positions, making sure that we have stability to how the top and bottom teeth fit together. At the final appointment, we will remove the braces or aligners, make patients retainers, and then take orthodontic records, again, photos or x-rays. So let's look at a couple of cases. We'll begin with a class 2 open bite case. Again, open bite where the top and bottom front teeth do not overlap, and class 2 relates to the overbite where we have a gap between the top and bottom front teeth. This is the beginning of treatment. This is the day that we place the surgical buttons. What we also do, and I like this as an example of a pre-surgical aligner, where we still want the patient to be able to wear something for the couple days before they go into surgery. And so we can take a hole puncher or a special instrument and cut out around our buttons, which are often along the gum line, so that way the patient has something to wear before they go in for their surgical procedure. And if possible, if we're not doing a segmental upper jaw surgery, the patient can wear these when their splint is removed several weeks after treatment. This is what the patient looked like after surgery, the day that they came in for us to remove the buttons, clean up the glue, and at that time we will take a digital impression for post-surgery aligners. Again, that's that post-surgery orthodontic phase around 4 to 6 months. And this is what we look like at the end, where we have the open bite addressed as well as the overbite there in the front. That would be an example of a class 2 open bite surgical case. Next, we will look at class 3, which is also known as an underbite. This was treatment planned for one jaw, top only. This is a patient that we'd seen in our practice since he was a kid, and it's very common for patients like this to come in at an early age with a bite that looks similar to this, maybe not as severe. And as they grow, it becomes apparent that there will not be a non-surgical option for correcting their underbite. So this was what the patient looked like at the very beginning. This is what we see from the initial cephalometric x-ray. And I think this is a great example of showing the position of the upper jaw, which is this line that you see right here, the position of the lower jaw, which is right here. And we can see a very large front to back discrepancy between kind of the center of the upper jaw here and the center of the lower jaw here. And the surgical treatment plan for this patient was to take this upper jaw and move it this way to the right of the screen as a way to bring it out to fit over the bottom teeth. This is what the patient looked like when we placed the surgical buttons. And what you can see on this picture on the right is after the surgery, this tooth, this canine, needs to fit into this groove. This bicuspid needs to fit into this one, and so on and so forth. So we have around 7 to potentially 8 millimeters of movement that will be accomplished during the surgery. This is what things look like 8 weeks after the surgery. One of the reasons that we love aligners for our surgical cases is there is significantly less issue with the gum tissue and oral hygiene. And this is a patient who has had buttons and rubber bands and a splint in place for 8 weeks. And the day that they come in, they have very, very mild, if any, irritation of the gum tissue. This is our final panoramic x-ray, and you can see where we have the hardware, plates and screws that were put in during the surgery. And this is what we look like at the end. And you can see from the picture on the right that we've addressed the underbite in the front, and we've established a proper occlusion of the back teeth. One more case. This is a narrow top jaw surgical expansion case. As you can see here, we don't have much overlap of the top and bottom. The main issue that we see is a cross bite of the top teeth, where the top teeth bite completely inside the bottom teeth. If this was a child, anywhere from 8 even up till 16 or 17, there may be an opportunity to address this non-surgically, but since this patient was not growing, the only option for this patient was a surgical procedure. What you will see in these pictures on the left is what the patient looked like at the very beginning, and on the right is what the patient looked like before surgery when we had placed what is known as the expander appliance. And the way the surgery proceeds is the surgeon will loosen the upper jaw and then will essentially cut the upper jaw down the center line here, and we will use this expander appliance to widen the upper jaw, where the right side goes in this direction and the left side goes in this direction. This is what things look like after surgery. And so the patient, after the surgical procedure, has turned or opened the expander once or sometimes twice a day as a way to separate the upper jaw to provide more width. This is what it looks like. You can see that we've widened, or what we say, opened the expander, and the gap between the top two front teeth shows that we've split or separated the two halves of the upper jaw. The nice thing is the gap closes up fairly quickly once we're finished with the actual surgical expansion. And this is what it looks like when we're all finished, where we have good symmetry. We've addressed the edge-to-edge bite in the front, and we now have a normal fit in terms of the width of the back teeth. The final topic is retainers after jaw surgery. They are worn lifetime at night. We usually do a step-down approach where when patients are finished with treatment, they'll wear their retainers for around 16 hours a day for 3 months, then 12 hours a day for 3 months, and then after that, just while they sleep. Here are several types of retainers. On the left, you can see a clear removable retainer. In the middle, what's called a Hawley. These are often preferred for the segmental upper jaw cases because they provide more rigidity in terms of the width of the upper jaw. And on the right, you will see an example of a bonded retainer for the top teeth or a bonded retainer for the bottom teeth. So to recap this webinar, an overview of orthodontics and jaw surgery. Again, this is for correction of a skeletal or jaw malocclusion bite issue in a non-growing patient. It combines orthodontics as well as jaw surgery, typically used to address large overbites, underbites, constriction or narrow upper jaw, or anterior open bite where there is no overlap of the front teeth. In 2023, at our practice at Gluck Orthodontics, around 90% of our jaw surgery cases are done with clear aligners. Patients don't have their jaws wired shut, and most of the treatment planning is done digitally, whether that's through three-dimensional x-rays, digital impressions with 3D printed models, or digital surgical planning, all done on the computer. We hope this was helpful. If you have any questions, you can reach out to our office anytime. You can send us a text message. We are also on social media, and the best way to find us there is to send us a direct message at Gluck Orthodontics on Instagram. Again, we hope this was helpful, and we hope you have a wonderful day. Thank you very much for your attention.